Good morning, I'm Vic Senese with UroNurse News. Hey, be sure to like and subscribe. Today, we're looking at an intriguing study that asks a simple question. Can what women eat actually influence their risk of developing recurrent urinary tract infections? If these findings are confirmed by future research, dietary counseling could become another valuable tool alongside traditional UTI prevention strategies. Researchers wanted to determine whether women following vegetarian or vegan diets experience fewer recurrent UTIs compared with women who eat meat. The idea comes from growing evidence that diet influences the gut microbiome, since many urinary tract infections begin with bacteria that originate in the intestine. Changing the types of bacteria living in the gut could potentially reduce the likelihood of recurrent infections. Now, this was a large cross-sectional study using data from the Adventist Health Study 2. More than 57,000 women with complete dietary and urinary health information were included. Participants were divided into 4 dietary groups: non-vegetarians, pesco-vegetarians, lacto-ovo-vegetarians, and vegans. Now, if you don't know what those mean, look them up, because I don't. Researchers also evaluated several known UTI risk factors, including age, body mass index, race, diabetes, and menopausal status. The average participant was 58 years old, and about 13% reported a history of recurrent urinary tract infections. Now, as expected, risk increased with older age, higher BMI, diabetes, menopause, non-black race, but perhaps the most interesting finding involved dietary patterns. The highest rate of recurrent UTIs occurred among non-vegetarians, about 14.2%, followed by the pesco-vegetarians, 13.5%, then the lacto-ovo-vegetarians, 11.6%, and the lowest rate was found in vegans, 10.3%. Even after adjusting for age, diabetes, menopause, race, and other variables, diet still remained independently associated with recurrent UTIs. Compared with non-vegetarians, lacto-ovo-vegetarians had approximately a 23% lower association with recurrent UTIs. Vegans demonstrated an even greater reduction, 31% lower association. That's a meaningful difference observed in a study involving more than 57,000 women. Researchers believe one explanation involves the gut microbiome. Plant-based diets may encourage bacterial populations that are less likely to cause urinary tract infections. In addition, diets rich in fruits, vegetables, legumes, and whole grains may reduce inflammation and improve overall metabolic health. However, this study did not directly examine the gut bacteria, so the exact biological mechanism remains uncertain. It's important to remember this was an observational study. That means researchers identified an association, not proof that diet directly prevents UTIs. Women following vegetarian or vegan diets may also differ in other lifestyle habits such as physical activity, hydration, smoking, or healthcare utilization. Even with statistical adjustments, these factors can influence results. For urology nurses and healthcare professionals, these findings suggest that discussing healthy dietary patterns may become another component of comprehensive recurrent UTI management. Current prevention strategies still include adequate hydration, behavioral modifications, vaginal estrogen when appropriate, targeted antibiotic prophylaxis, non-antibiotic preventative therapies. But dietary modification may someday join that list as another evidence-informed option. Here's today's takeaway. Women following a lacto-ovo-vegetarian and a vegan diet reported significantly fewer recurrent UTIs than non-vegetarians. While these studies cannot prove cause and effect, it provides compelling evidence that nutrition may play an important role in urinary health and deserves further investigation. Future prospective and randomized studies will help determine whether adopting a more plant-based diet can actually reduce recurrent UTIs. I'm Vic Senese. Thanks for watching UroNurse News. Hey, if you enjoyed this evidence-based update on the latest in urology research, please like the video, subscribe, and share it with your colleagues. Coming tonight on Dr. Jeff Talks About Sex and Intimacy, what if one of the most powerful relationship builders happens after intimacy? Tonight, Dr. Jeff explores the science behind the afterglow effect. the emotional connection, trust, and goodwill that can strengthen relationships long after intimacy ends. Want to know what the afterglow effect is? Well, you better tune in tonight at 7 p.m. drjeffsextalk.com. You know, it's right there. Tomorrow on UroNurse News, we're diving into a topic that's generating real clinical interest in post-prostate cancer recovery. Can testosterone therapy combined with magnetic stimulation improve continence after robot-assisted prostatectomy? Many men struggle with urinary leakage after surgery, and recovery can be slow, frustrating, and unpredictable. But emerging research is exploring whether restoring hormonal balance alongside pelvic floor neuromodulation may actually help accelerate continence recovery, improve muscle responsiveness, and support overall pelvic function. Join us tomorrow, you'll find out.
Thanks for watching UroNurse News. The expert's opinion in this communication are personal and not representative of any organization. They are for informational purposes only, not official guidance. Viewers are advised to use their judgment, seek additional advice, and take responsibility for any actions based on these opinions.